quorum, so I'll call this meeting to order. Today, Chairman will be back a bit later, so I will, for the time being, act as Chairman. We have just one topic today, and that is to review the Disability Allowance under the Social Security Allowance Scheme. So let's invite the administration to walk us through the information before we start the discussion. Ms. Tam, please. Thank you, Chairman. Before the start of the meeting, I need to apologize that in fact we have submitted two papers at rather a late stage. I will walk you through the first paper, and I'll invite the Social Welfare Department to walk you through the second paper. Now I'll take you through CB bracket 2665/1213 bracket 01. That's about the review of disability allowance under the Social Security Allowance Scheme. Last year, this panel held a meeting in December, and deputations attended the meeting. And at that time, we proposed to set up an interdepartmental working group to study on the eligibility criteria for the Disability Allowance DA. And subsequently, in the policy address, the Chief Executive announced that the working group would be formally set up to study the subject of allowing people with loss of one limb to apply for DA and related issues. The Interdepartmental Working Group has just been established. It's called Interdepartmental Working Group on Review of Disability Allowance, and I will hereinafter refer to this working group as the working group. And the membership list is in Annex 1. Basically, we have 3 policy bureaus and 4 departments, including Labour Department, Department of Health, Census and Statistics Department, and Social Welfare Department. But should there be any other need to engage other organizations or departments, we will, as necessary, invite them to take part in our work. And for terms of reference of the working group, would members please refer to paragraph 5. I won't repeat them. And the major work directions is set out in 6A and B. Basically, we collect and analyze the relevant information and data. And secondly, we explore various options and do assessments, including the number of potential recipients and the policy implications and financial commitments. And there are 3 points I'd like to make. Under the Commission on Poverty, there is the Social Security and Retirement Protection Task Force, and we do have some interactions with them. We note that the disability allowance is under the Social Security system, so we feel that we have to prudently report to the task force and, when necessary, seek their guidance or instructions. Secondly, I'd like to inform members that in Annex 2, we have the disability allowance cases by type as at the end of November 2012, and the total number stood at 146,670 cases. Details are set out in Annex 2, and I'd like to refer members to Para 9. The Ombudsman in October 2009 released a report called the Direct Investigation Report on Granting of DA and Processing of Appeals by Social Welfare Department, and the Social Welfare Department earlier on set up a working group on the review of this mechanism. It was chaired by Mr. Lam, and following that, some recommendations were made, some follow-up work has commenced, and some members have also given their comments, and based on the members' views and the Ombudsman's recommendations, some other recommendations have been proposed. And Chairman, if you agree, I will invite Deputy Director Mr. Lam to take us through the second paper. Thank you. The second paper, that's CB bracket 2684/1213 bracket 01, is that the paper you're referring to? Yes, it's a rather lengthy paper, so please briefly walk us through the paper. I'd like to say something about the investigation conducted by the Ombudsman and the follow-up work by the department. Basically, the Ombudsman's investigation had to do with whether the department had impartially assessed and approved the cases in accordance with the guidelines, and whether the implementation of the mechanism had been done in a way that's objective. And in terms of the medical assessment form and internal guidelines and application procedures, whether they were clear enough so as to reflect the objectives of the scheme. And there was also a need to delineate clearly the responsibilities of the department. Later on, the department set up a working group to review the details of the implementation of the scheme. And the Labour and Welfare Bureau and the Department of Health, etc., were involved. And in line with the objectives of the disability allowance, some adjustments were made to the medical assessment form and the checklists and guidelines and the relevant roles and functions of different parties. And these have been followed up. And at the last meeting at the Legislative Council on the 10th of December, the Ombudsman on the 15th of January wrote to the SWD in relation to some questions raised and some further points responding to the various points made by us. And we also provided a summary of a point-to-point response and answers to the questions, which are now set out in Annex 2. And in terms of the guidelines on medical assessment, the checklist guidelines, some adjustments have been made to the procedure. We hope that the assessment could be done in a consistent and objective manner. Let me give you some examples. For example, in terms of assessment, for severe disability has been highlighted as the focus of medical assessment, because in the form there is an entry called other circumstances, and this is important as it's relied on by many as the approval criterion. It involves disfigurement and other visceral diseases, physical, mental conditions, etc. And if, in the doctor's view, this criterion is met, then the patient would be given the allowance. And the working group is of the view that the assessment should be made based on the functional disability, the degree of functional disability of the patients. And therefore, we have updated the medical assessment form by setting out the functional disabilities as the highlight of the assessment, so that basically the person's personal ability to care for himself, communication ability, emotional control, and social behavior, etc., would be assessed. And for patients to be made known of the doctor's assessment, if the patient is regarded as severely disabled, some checks will have to be appended on the checklist, and the doctor must explain very clearly that the patient has failed in all three of the criteria. And should that patient require constant care, and owing to the change of circumstances, the patient no longer requires constant care, or after the initial assessment, if there are change of circumstances of the patient to the extent that the patient is no longer permanently disabled, the doctor must state the reason why. And some guidelines and forms have been prepared for medical staff, including doctors, so on and so forth, to enhance communication. And we will also step up training and communication and liaison between departments so as to achieve consistency. The other point is that in relation to the appeals against the notification letters and the medical assessment forms, the Ombudsman has asked for greater transparency And we have adjusted to the extent that if the patient has failed to meet the criterion of severe disability, the doctor must state the reason why and the considerations given in the assessment. And now the Labour and Welfare Bureau has set up an interdepartmental working group allowing people with loss of one limb to apply for disability allowance. This is a new development, and in the future, the recommendations proposed by the working group may affect the implementation of the scheme, and time is required for the working group to conduct studies. So our proposal is that for the short and medium term, we should try to implement the recommendations proposed by the SWT, for example, improvement to the medical assessment form and the procedures, so that medical social workers and the SSU staff and the doctors will be given a new set of guidelines and forms. Whereas in the longer term, we will then wait for the recommendations proposed by the working group under the Labour and Welfare Bureau. As for the new medical assessment forms and guidelines, we will need to adjust the computer systems. We'll also need to publish new pamphlets, etc., and also some training given to staff like medical social workers, doctors, and SSFU staff. We expect the implementation to take place towards the end of this year, and this is the short to medium term proposal for members' consideration. And I'm happy to take questions and comments from members. Thank you. All right, we'll start the discussion now. Members, please raise your hands. We have 4, Wong Kwok-che, Fernando Zhang, Albert Ho, and Tang Ka-piu. So I'll just impose a time limit. Members, please observe this limit. You can wait for a second round or third round. So the time limit is 5 minutes, questions and answers included. Mr. Wong Kwok-che. Thank you, Chairman. I'd like to ask the administration regarding 665/1213-01. This paper says that there are major working directions set down for the interdepartmental working group. You have the direction, but you don't have a timetable. So how long would it take for work to be completed? So I'd like to ask when a result would come by, because it seems you have this major work directions like collecting and analyzing the relevant information, the data, so on and so forth. Well, that could take years, like 8 or 10 years. But for the disabled, they are suffering. Well, Ms. Tam, you have also received the concerned groups, etc., and they are suffering because they need to work and they need the allowance. So the first point is about timetable. Second point, the administration has issued some registration cards for the disabled, which state that they are suffering from a degree of permanent disability, and their conditions are also stated. Well, the administration, having received the deputations and myself, knew clearly what I'm talking about. Now, the administration has rolled out the $2 trip fare concession scheme for the disabled with the loss of one limb. They really need to be included in the scheme so that they can benefit from it, because they need to work, they need to visit relatives, so on and so forth. However, they are not the eligible persons under the scheme. So in relation to this group, or this issue, can you allow people with the loss of one limb to become beneficiaries under the scheme first? Thank you. Mr. Wong's questions comprise two parts. First, on timetable, when Mr. Wong led the groups to... All right, please lower the microphone. Please speak into the microphone. Or I will move forward a bit. Chairman, that day Mr. Wong and the deputations met me and we exchanged views on this matter. I reiterate that this interdepartmental working group will not drag its feet. But as I said just now in the paper, we will explore various options. We do not have a concrete proposal for the time being. We will need to work with the interdepartmental working group and try to explore various options on the basis of data and information. If you ask me for a concrete timetable, first of all, we don't have one. The interdepartmental working group has yet to explore various options. We don't know how long this will take. Secondly, if I arbitrarily give you a promise, this won't be prudent enough. But I agree with Mr. Wong that we should take this forward as soon as possible, and we will try our best to study in detail this matter and to make good use of the time. And we'll also make sure that the procedure is transparent. We'll report to members. We'll also report to the task force under the Commission on Poverty so that members would learn the progress of our working group.
And secondly, Mr. Wong talked about the transport concessions. As you all know, the $2 transport concessions, when we introduced this, was really to take care of 65-year-old seniors or those above 65 years old, or CSSA recipients or severely disabled persons. We're considering to extend this concession to those under 12, children under 12. And we are awaiting the SWD for the completion of their computer software changes before we can achieve this. As for the $2 transport concession, of course, we have to take into consideration the interdepartmental working group and their opinion on the definition of disability. I have two follow-up questions. One, the timetable is still, a question is still left unanswered. And Mr. Leung Chun-ying, the CE, in his manifesto at the time of election and in his policy address, have mentioned the concessions for single-limb disabled. Now, starting from the announcement by the CE, I think we should backdate that kind of payment to that particular date. I think that is only fair. Can that not be done? Yes, very briefly, please. Yes, Mr. Chairman, concerning this kind of reviews or where concessions are given, there would not be any recourse period, usually. Whatever the review period, if you say that we will have to go back to the date of the announcement by the CE, I think that is quite impossible. Mr. Chan Chiu-hong, 2005 it was that I started talking to the government about this disability subsidies. Can you please speak closer to the microphone? Yes. In 2009, the Ombudsman voluntarily came up with a review and pointed out a lot of deficiencies on the part of the administration. And after much dragging of the feet, it was at the end of last year, at the time of our meeting, that they produced the report from the Ombudsman. Otherwise, we wouldn't even know that there were such a report. And because it did say in the report that that the recommendations would be followed up. Now, there is an interdepartmental working group, but there is no timetable. I just came from the medical panel, and Mr. Koh there said that he will review the entire mental health disability situation within a year. I mean, there is a timetable mentioned even there for that kind of complicated work, but it is lacking here. I mean, this is unacceptable. If you have that determination, you should be able to come up with a time period, whether it be 6 months or a year, that would be acceptable to me. But if you keep it open-ended, then it only shows that there is no commitment. And further to that, it was suggested that we can come up with take certain steps first. In your recommendation, there are some items which are alarming. For example, in the form, for example, the Ombudsman review findings, para 22, you say that 100% loss of loss of earning capacity. However, the comment had been that this is difficult to assess by the doctors, and that this definition should be deleted in total. I'm reading. Now, deleting the so-called 100% loss of earning capacity, and in its place you have put in a loss of 100% of ability to make a living. It seems that you are playing around with words, and it's come to none. There is a very grave family burden and financial outlay for these people, but on the other hand, in face of that, you are playing with words. And it's been so many years since this report. Why have you not done anything? Are you going back on your word? You come up with an interdepartmental working group, but still you have no timetable. How long do you want to drag it on for now? All right, who will answer the question? Mr. Chairman, I will ask the Assistant Secretary to answer that question from Mr. Cheung concerning the Ombudsman report. As for the timing, I think I've answered Mr. Wong just now. There are 3 points I would like to touch on in my response. First of all, concerning the timing. It is longer than originally envisaged, that is true, but there were certain incidents. From March of 2010 to July of 2011, there was a judicial review case and an appeal from the party to the case. And the legal opinion was that, well, actually, we were in a consultative period at the time, and we had to stop the consultation work, and therefore resulting in delays. And for this improved medical assessment, we will need time as well, because there are different specialties at the HA, and there are doctors concerned, and that would take time for that process to take place. So I would like to provide an explanation there. As for 100% loss of working capabilities, this is something that we have gone by all along. But whether this person has any employment or whether he has any working ability is beside the point. And therefore, we have suggested that we put the definition as the functional ability of this person. And that is the physical functionality of the person is what we will focus on. As for children, the doctors have reviewed that and find it satisfactory for assessment purposes. Now, there is an asterisk And after the asterisk, it says 100% loss of earning capability is made equivalent to the severely disabled persons. What exactly is the difference, if there is one? Well, Mr. Chairman, for severely disabled, there will have to be certain references to that definition. And all along, we have referred to the definitions under the relevant ordinance, and different grades of severe disability is mapped out, and basically it is defined as requiring care, and it has nothing to do with earning capacity. And therefore, in our guidelines to the medical doctors, we also specify that the two are not linked. Well, if that is the case, then delete it. The Ombudsman report had indicated the same. Why do you still keep it here? All right. We go on to Albert Ho and Tan Ka-poon after him. Mr. Chairman, the two colleagues who spoke before me have both asked about the timetable, because we are truly annoyed. This government is resorting to time and again delays because of having to work through things, etc. Now, those who are waiting for the policies are suffering. All these years there have been unnecessary dragging of the feet, resulting in loss and failure to care for the cases. Now, what exactly is the relationship between the policy or the existing policy under judicial review and the needs of the society to move forward? The two are not in contradiction of each other. You are citing that because there is a court case and we will have to stop the review, that is unnecessary. And there is no timetable whatsoever. We cannot accept that, and we cannot even comprehend the reason why. Now, the scope of review, actually, I didn't understand the administration's response. Do we really need to specify 100% loss of capacity? Because we know that different disabilities actually result in different incapabilities. Let's say loss of eyesight, resulting in loss of 90% of eyesight. It is very difficult for such a person to find employment. For example, the security guard who is left with 10% of eyesight, he can no longer find any work in the security field or otherwise, and it's resulting in long-term unemployment. I mean, do we have to specify the 100% loss of capacity? Now, for severely disabled, I think we should increase their subsidy significantly, because the carers will have to devote time to care for these people. If you do not increase the subsidies for these severely disabled so that the carers can have some sort of resources to rely on to care for the needy person, then it would not work. So do you have that room, I'm asking, to review these most severely disabled subsidies? For those who have completely lost the ability of mobility, for instance, do you have the room to review and enhance or increase the subsidies? I mean, the Ombudsman had already criticized this, so on and so forth. How can it be that there still is no timetable? It cannot be any more than 1 year, to my mind, at least at the most 6 months for a response.
So, PS, your response, if you have any response, the difficulties, please tell us. Well, there are many parts to the question. First of all, for the disability allowance, itself, when it was introduced in 1973, it was catered for the severely disabled so that they get a special assistance. Compared to the CSSA, which aims at providing living supplement to recipients, the nature is different. And there are two different rates for disability allowance. One is normal disability allowance, the other is higher disability allowance. For higher disability allowance, only those who require constant attendance from others in their daily life are eligible, and the rate is higher, or in fact is double the normal DA. Mr. Ho raised this point, asking whether for the severely abled, whether a high rate should be granted. Well, we can look into this in our review, and also about the study that we conduct with the SWD. Well, it may be somewhat confusing to members, and that's why in para 9 we set out the details. For SWD, it is a follow-up on the direct investigation conducted by the Ombudsman, whereas what we're discussing here is the Chief Executive's promise in the manifesto that person with loss of one limb can be allowed to apply for DA. And because of the judicial review, the judicial review had to do with the SWD's review. It has nothing to do with what we're discussing here. We are not affected by that judicial review case. And am I allowed to continue? I see the time. Okay, can you tell us the difficulties you have in coming up with a timetable? Otherwise, you may need to give us a timetable. Mr. Ho proposes 6 months. Is it feasible? Well, Chief Executive stated in his manifesto that people with loss of one limb may be allowed to apply for DA. Well, 6 months may not be a problem for us, but we have discussed with many groups, and at this LegCo panel meeting, we also received over 70 deputations in last December. We don't want to simply go through the motion by fulfilling the CE's promise in his manifesto. We want to look at people with loss of one limb or people with more severe degree of disability and what can be done for them. And once we decide the way forward, there may be various options in terms of assessment. So members and groups have given us a lot of views. Some are simpler, for example, having different levels of allowance, and some involves more fundamental changes, having made reference to overseas experience. Dr. Wong today also has submitted a paper, and he said that there are 240,000 combinations if we are to devise different levels of allowance, and we need time to build up a database. So we need to consider the existing mechanism. We also need to consider the review of the eligibility criteria. I think members would not want me to say that within 6 months, yes, we can implement the proposal of allowing people with loss of one limb to apply for DA, and that's it. We don't want to see that. Yes, you can follow up on this, Mr. Tan Ka-pil, followed by Dr. Helena Wong. Yes, I have a question. Now, as I understand, if there is no mentioning of this proposal of allowing people with loss of one limb to apply for DA in the policy address, then there shouldn't have been the establishment of the interdepartmental working group. But I think that you have mistaken the Ombudsman's report. Does it mean that without the CE's proposal, The interdepartmental working group will not exist. That's point number one. Point number two, the SWD received from the Ombudsman the recommendations on the granting of disability allowance on the 15th of January. I'm very curious. In December, or in the 10th of December last year, there was a letter. There was a submission. And in short, I'd like to know whether the Ombudsman has agreed with your work to be followed up. I'll answer the first part of the question, and I'll ask Mr. Fong to answer the second part of the question. Now, my understanding is this. When Ombudsman releases a report to the SWT conducted a very detailed study, followed by some follow-up actions. The Ombudsman also gave further views. There were differing views, and we note that in the manifesto, the Chief Executive has indeed stated something about the application for DA, but it doesn't mean that without the CE giving this undertaking, we will not carry forward with this work of the interdepartmental working group. Yes, Mr. Fong, Deputy Director. On the 10th of December, when we attended the electrical meeting, we submitted the paper for the Ombudsman's consideration. And after considering our paper on the 15th of January this year, the Ombudsman replied in the form of a letter to us. He is of the view that that was not a point-to-point response, and he asked for a point-to-point response, and we have duly prepared such a response. And today, such a response has been included in Annex 2. And in fact, for this point-to-point response, it's basically similar to the paper that we submitted last time. Last time we had 6 points, but this time we had 7 points, and that's the only difference. That's a matter of layout. And the Ombudsman also asked us for supplementary information, i.e., when a doctor assesses a patient's functional capacity, whether the doctor can have consistent assessment for patients who are using assistive device or are on medication. And the second question is how we explain clearly to applicants the definition of severe disability. That's the eligibility criteria for the disability allowance. We explained to the Ombudsman that we will publish pamphlets at the time of application. Our colleagues will also explain the eligibility criteria and the procedure to patients. And the HA and the Bureau also had a mechanism, and on an annual basis, the various departments and bureaus will put their heads together and discuss the cases received and complaints received, and for the issues raised, we would look at how improvements can be made. The other point is about the appeals board, and we have also changed the layout of the notification or the format of the notification letter to appellants. Now, just a follow-up question. If the Ombudsman rejects your explanation, what should we do about it? And even if the Ombudsman welcomes your work, if LegCo doesn't agree with your work, what are you going to do? Well, that depends on whether they will further give us any letter. We will continue to follow up on the matter by replying to the questions. Next, Dr. Helena Wong. Thank you, Chairman. I am really confused. At the end of 2009, the SWD established an interdepartmental working group in response to the Ombudsman's investigation. Now, towards the end of 2012, because of something stated in the Chief Executive's manifesto, the Bureau then established another interdepartmental working group. You said that these two working groups are independent of each other. Does it mean that they just go on separate ways and do their own work? I am confused. Both are working on the review of the disability allowance. Does it mean that the department will be the leading department covering a wider scope, whereas for the Bureau's working group, you will only focus on persons with loss of one limb? Is this the delineation of work? If the Bureau's working group has to collect and analyze relevant information and data, so on, and conduct studies simply on the issue of the people with loss of one limb, then, well, of course, you will not focus on just a single issue of people with loss of one limb, but rather the policy as a whole. So my question is whether similar studies have been conducted by the department's working group back then. Would that be a waste of resources? I'd like to know more about the delineation of work. P.S. Chairman, I agree that it may cause some confusion to some. In 2009, when the Ombudsman released a report, the title clearly states that it's a direct investigation report on granting of DA and processing of appeals by the Social Welfare Department. So it had to do clearly with the procedural matters and the processing of appeals by the Social Welfare Department, whereas for the Bureau's working group, for Mr. Fong, he was talking about the response given following the recommendations of the Ombudsman, and the further report has already been submitted to the Ombudsman, and he will definitely follow up on any further views. Whereas for this interdepartmental working group newly established by the Bureau, the purpose is to follow up on the statement in the Chief Executive's manifesto of allowing persons with loss of one limb to apply for disability allowance, as said by Dr. Wong. Our work does not involve simply adding this group of people with loss of one limb as eligible persons to apply for DA. Rather, we look at things on a macro scale. For those who are disabled, or those with loss of one limb or other degrees of disability, we will consider whether they should be made eligible for DA. It's exactly because we do not want to take things a simple way that we review the eligibility criteria as a whole, whereas for the department's working group, it's on the review of the processing of appeals by the SWD. Right. In that case, I really don't see why you have to split it up into two working groups. For the new working group, you say you do not just look at the issue of people with loss of one limb, you look at the overall policy as well, and that's what makes me confused. Why the need to split up the working group into two? Originally, you had a working group in 2009 doing this sort of work already. Why hasn't a review be conducted holistically? But it's been 3 or 4 years. Oh, may I interject at this juncture? If you're asking for a review of the rates of the DA, and this is not the issue to be discussed today. Now, this working group is about eligibility criteria. As for the working group set up in 2009, pursuant to Ombudsman's report, it's about the administrative matters and whether there is any fault on the part of the Social Welfare Department. Mr. Fong, anything to supplement? No? All right, next, Mr. Leung Yu-chung. Chairman, just now the administration replied to Dr. Wong's question about terms of reference of the working group, whether they would solely focus on the manifesto's statement that we will, quote, will also allow people with loss of one limb to apply for DA. I don't know if I've heard it correctly or not. If the focus is not solely on this matter, then this paper will have to be rewritten, where I'm talking about paper CB bracket 2665/1213 because under the terms of reference, there is point A and point B, 2 points only. Point A, as the Chief Executive has stated in his manifesto, that we will also allow people with loss of one limb to apply for disability allowance. The working group will review the eligibility criteria for DA, assess the implications on various options on policy, etc. It doesn't say that a comprehensive review would be conducted on the eligibility criteria for DA, and this is a very important issue. The deputations we received on the last occasion also talked about this point. Because the last bit is the most important, eligibility criteria. Well, I don't know whether only people with loss of one limb would be allowed to apply for DA. If this is not the only focus, then you should delete this first part of the paragraphs such that it reads, because of the various doubts on the eligibility criteria for DA, a comprehensive review should be conducted.
Then I'd be much happier if that is the way you handle it. Well, I may not be fully satisfied, but it's a step in the right direction. Mr. Chairman, you have supplemented on their behalf, but I do not know whether that is their supplement. But definitely there is a gap between what is described here in the paper and what they said. Otherwise, I really cannot say I trust you, because at the end of the day, you may still fall into this very narrow definition trap. And this is really quite out. This CE manifesto statement regarding loss of one limb, because a lot of such people are denied DA. I mean, if you are just limiting yourself to this narrow definition of loss of one limb, then I think it is insufficient. So would you please amend your A? As for B, there it says exploring various options, including assessing the number of potential recipients, policy implications, financial commitments under these options with regard also to other supports and services available to persons with disabilities. Now, anything and everything is about helping the poor. I'm very upset with this. This disability allowance has nothing to do with helping the poor. It is more macro than that. This is to allow providing help to the disabled so that they can re-enter society and community. I mean, everything is about helping the poor, isn't it now? Retirement, etc., etc. I mean, perhaps Miss Carrie Lam should take up everything. Well, thank you, Mr. Chairman, for the two questions. It is an actual fact that in the manifesto, the C had mentioned the allowing people with loss of one limb to apply for a DA. As for the terms of reference, we have mentioned that we will be reviewing the eligibility for receiving such a DA, and also for people with loss of one limb or people with more severe disability than these. We will be considering the relativity of their eligibility as well. Well, please do not quote anything. Do not quote the CE's manifesto. Just say simply that with a lot of views reflected by the public concerning this, we will, so on and so forth. Why do you have to say, the manifesto, the CE's manifesto, and allowing people with loss of one limb to apply for DA? Well, you can interpret this as having hurt the community. No, actually, this is not just about loss of one limb. For the deputations, they did not limit themselves to people with loss of one limb. Yes, the administration, please. Well, actually, for the for helping the poor and the Commission for Poverty, they are helping people for retirement and disabled people, and also for upward mobility of the people. And therefore, we feel also that we should refer to them. And also, this is to for enhanced transparency. Well, she is just reciting from text. But did she take what I said into regard? Can you please take Mr. Leung's point into regard? Well, actually, for the terms of reference, we have discussed with the interdepartmental working group and the Commission for Poverty. If we want to change this, we will have to go back for further discussions with them. So are you here to notify us or to listen to us? If you're here to notify us, just tell us so. We do not need discussions. We do not need to waste time on a meeting. If you're saying that you have had discussions at the interdepartmental meeting, then we do not have to waste time here, Mr. Chairman. Yes, all that we've said have been minuted. And what does that amount to, Mr. Chairman? None. Nothing. To the administration, it amounts to nil. Well, will they or will they not go back and consider my points? They can't even respond to me on that. Well, I think they have. And what is that response? Please clarify. My interpretation is that she will not accept it, what you said. Is that true? Well, Mr. Leung, we will go back to our working group to discuss the point that you have raised. But as I have explained just now, in terms of reference in setting that, we have taken into account your concern. We have considered the concern that you raised. Yes, we will be looking into eligibility and other relevant measures and also other opinions and suggestions raised. And I hope you will also take that into regard as well. Well, I think it will be the same broken record again and again, even if you pursue. So let us go on to the next round of questioning. Now, I will use my questioning time from the first round to ask the following question. In the last session of deputations, the conclusion was that the deputations were of the opinion that the disability can be physical, sight, hearing, etc. It also can be mental, can be long-term illness, including mental illness or rehabilitation, renal diseases, etc. And for paper 665 from the government, there is no specification on these particular areas as mentioned, and it is more a general kind of framework for our knowledge. Now, I'd like to know from the interdepartmental working group, what exactly did they delve into concerning their terms of reference and the areas that they would focus on? Have you talked about difficulties and the ramifications for the future? The LegCo will be monitoring the progress of this entire matter. I know that the government will not give us a timetable. You cannot draw blood from stone, I'm sure. But next month or the month after that, at the time of the welfare panel meeting, the administration will have to come forward with a timetable. You cannot carry on without a timetable as to when you will present your so-called homework. And what exactly is severe disability anyway? In responding to the Ombudsman, you have deleted the 100% earning capability. But as mentioned just now from the administration, you have put in functionality. Is this physical functionality, social functionality, or what? You will have to tell us what exactly is the definition of severe disability. Where does the administration draw the line? Not only we need to know, but those medical doctors in the line for assessing these cases will have to know as well. So would the administration let us know at what point of work you are at now? And perhaps the Deputy Secretary can also enlighten us as to the delineation of severe disability. Well, our working group have had one meeting. As for our terms of reference, we have discussed the same. First of all, we have to know that we will focus on the eligibility of for DA. As mentioned earlier just now, we will also be looking at single limb loss or similar situations, people who are denied DA because they are considered not eligible, how we should deal with such cases. We have also considered the eligibility for DA. How should we assess the degree or severity of disability? We will have to consider this as well. It may be similar to or not similar to what we had before. Different regions and areas may have different time spent on assessments. And we know of the cases and possible appeal cases. And whether in the administration and handling of such cases, whether there had been undue length of time and resources used. So it is really rather complicated. So we will be looking at these other relevant areas, and we will be talking to the Central Policy Unit concerning this. Now, can you also address the severe disability cases? Yes. Concerning the details for execution, we are following the existing policy intent for severe disabled cases under the existing parameters and the original policy intent. The definition of severe disability under the Employment Compensation Ordinance is 100% loss of earning capacity. Basically, under such circumstances, the cases will be considered severely disabled, and these cases need a lot of special needs on a day-to-day basis. But it is not about whether the person has employment or whether the person is making any money from work. We are still utilizing this original definition, but in the guideline, we are also putting doctors on note the ability to work, and whether there is work or employment is irrelevant to the assessment. Other items are very easy to assess. For example, loss of both hands or arms or both legs would be very easy to assess. But for other situations such as mental disability, we have specified for any disfigurement, any diseases, including visceral or mental or functional, as long as the doctor assesses that the criteria are met, then the DA would be granted. So this is an assessment on functionality. And as I have mentioned before, we have spelled those areas out, and I will not repeat them here. Now for this interdepartmental working group, before there is a definition of severe disability, then the SWD will still be using the definition as underpinned by earning capacity. Can I understand it as such? Well, otherwise, it would seem that you have a new definition. Well, this is still a reference. Yes, it's still underpinned by earning capacity. Is that right? Well, but we clearly specify in your answer to Mr. Chung just now, or Dr. Chung just now, you said that you can take away the 100% loss of earning capacity. But going back to the definition for severe disability, you will need to have a definition anyway. I think we all understand this. Yes, there is still that reference to it. But the main assessment criteria are functional in nature. Yes. Mr. Wu Chi-wai, still the first round.
Sorry, Chairman, I'd like to clarify a point. That it's mentioned in the paper that last time a lot of members of deputations talked about the public transport concession for the disabled, and the administration last time promised that it would be subject to review as well, but it's not included in this paper. So I'd like to clarify this point, how this can come into discussion. You're talking about a $2 trip concession? Well, it's very easy. We will work on the definition of severe disability, and then they will become eligible for the $2 concession. Well, that's just my interpretation. P.S. Would you like to say something in response? Thank you, Chairman. When I answered Mr. Wong Kwok-cheng's question, I already said that we understand that in terms of the $2 trip public transport concession, many people would like to see the eligibility criteria relaxed so that more disabled people could get the concession. But first, when we considered expanding the scope to cover more disabled people than the existing eligible persons, we are looking into the feasibility. I suppose we will draw reference from the recommendations of the Interdepartmental Working Group on the DA review. All right, Mr. Wu. So it means that there won't be a separate item for discussion under this working group, or nor would it be included as part of the terms of reference. All right, thank you. Next, the second round. But before the second round commences, I'd like to remind members that Mr. Tan Ka-pyo has drawn up a motion. I won't deal with it for the time being. I'll let members see if you wish to make any amendments. But if we are to deal with the motion, there should be a quorum of 6, including myself. Second round, Mr. Wong Kwok-cheng. Chairman. First, I'd like to give a response. Some members, including Dr. Helena Wong, asked about the 2 working groups, the 2 studies conducted by the 2 groups. In fact, for the first review conducted by the SWD's working group, the administration has failed to address the concerns of the Ombudsman. That's the truth. So when I asked a question in the Legislative Council, I was subsequently given a letter in reply, but it's confidential, so I cannot circulate it among members. And clearly, the Ombudsman says that the SWD has failed to address the concerns raised by the direct investigation report of the Ombudsman. And today, in fact, the Ombudsman asked the administration to review the definition of severe disability, and everything else is not of primary importance. So, Chairman, you have given a very correct analysis. Now, second point, I'd like to ask Ms. Tam. Why is it that the administration is bunching everything together, such that only after the review would the proposal of allowing people with loss of one limb to apply for DA be implemented? It's a good deed. Why can't it be taken forward? I really don't understand. This is in the Chief Executive's policy address, but now you are not taking it forward. You are acting against the policy address. I really don't understand. Let's set aside the matter of eligibility criteria and the allowance rate. This is very clear. This is black and white. For those with loss of one leg, they should be given the public transport concession. And yet they are not eligible at the moment. Why are you refusing to expand the scope? Why are you bundling the two together? There is no need to do so. I believe that even if these people are made eligible, then other disabled people will not make any objections anyway. I know that people suffer from different disabilities like renal diseases or loss of sight or hearing, etc. But as long as you are a holder of the registration card for disability, you will then be eligible for the $2 trip concession. Why can't this be done? What are the difficulties? P.S. Any middle-of-the-road approach? Chairman, I understand that members wish to expand the $2 trip concession so that more can benefit from it, but the original design is that only people aged 65 or above, or the disabled who are also on CSSA at the moment are eligible. Now, as for the so-called disability card, it covers various degrees of disabilities. So when we consider relaxing the criteria for the $2 trip concession, we need to consider the policy implications and financial commitments. So when we consider whether to expand the scope of the $2 concession scheme to make more people eligible, we will definitely consider the working group's recommendations. I ask for Mr. Wong's understanding. Chairman, I definitely cannot tolerate it. I don't understand it. I cannot tolerate it. It's outrageous. It's a good deed. It's a good policy. Mr. C.Y. Leung has also undertaken to do so. But you are acting against his undertaking. For the disabled, they told me this. So Wong, even if we go to Shenzhen, even if we're not residents of Shenzhen, we can ride on public transport for free. However, in our own jurisdiction, we do not enjoy this concession. So this is unreasonable and shameful. How can the administration keep on refusing them the benefit? As holders of this card, they can ride for free in Shenzhen, whereas in Hong Kong, they are turned down. Isn't that outrageous? P.S. Anything to supplement? Like I said just now, when we consider relaxing the eligibility criteria for the $2 trip concession, we will consider different views. Now, we will know this in 2 days' time. The government is sitting on a $60 billion huge reserve. Even if you only use the interest, you'll be able to provide the DA for them. So it's unreasonable. Mr. Wong, I suppose you have fully expressed your point. So Dr. Fernando Jiang, followed by Mr. Tan Ka-piu. Chairman, this is really difficult to get something out of them. First of all, if they can't even give us a timetable, I think they should be reprimanded. I have never seen such a case where a department says, we do have a timetable, but we can't give you a timetable. There have been discussions at this council. There has been a report issued by the Ombudsman. There has been an undertaking given by the Chief Executive, and yet they say that we don't know when we will be able to complete this work. Isn't that unreasonable? And the second point, which bureau is the leading unit? Is it the Labour and Welfare Bureau? If the Permanent Secretary is taking the lead, then will you also need to consider other departments before you can decide when you can complete your work, or are you just looking at when you're going to retire? So I think that Mr. Tan Kapiu's motion is really too mild. I'm going to propose some amendments. Now, the other point is that one of the controversies is that if you define whether a person is severely disabled or not, it doesn't have to be related to the person's earning capacity. And in the Ombudsman's report, was clearly suggested that those wordings should be deleted. And yet, you continue to have it included with an asterisk, saying that according to the Employees' Compensation Ordinance, the severe disability is roughly equivalent to the loss of 100% of earning capacity. And then, Deputy Director said just now that the level of disability or of severe disability doesn't necessarily correlate with the loss of 100% earning capacity. So can you explain this to me? On the one hand, you say that it doesn't really necessarily have to do with loss of earning capacity. On the other hand, you rely on the Employees' Compensation Ordinance. Well, I really don't know how to put it. So, in short, it has nothing to do with whether the person can work or not. Can you explain to me the concept behind it? Right, understood. 2 questions. Now, first question, Permanent Secretary, about the timetable. But I think this is the 4th time you attempt to answer this question. Thank you, Chairman. In fact, the Interdepartmental Working Group is striving hard to do its work, and as we hope to achieve what is set out in the terms of reference, we want to assess the various options and consider matters on policy implications and financial commitments. And this time round, the review may not be on the approach similar to previous reviews, but when we grasp this issue, when we consider the issues at the first meeting, we were unable to come up with a concrete timetable as to when our work could be completed. So we should not irresponsibly quote a time frame. Let's say we need to consider other jurisdictions and draw reference from them, and that depends on how many jurisdictions that we consider. For example, say if the Central Policy Unit may reply to us that it may take 9 months or even a year if we are to explore the practices of, say, a number of jurisdictions. So we should not set down a time frame first. We should set down what we have to do first. We're taking a responsible attitude, and that is why we are not setting down a time frame and then try to reduce our work to fit that in. That's the Director. Now, as explained just now, according to the policy, the eligible persons under the DA would be those of severe disability, and assessment is required. We rely currently on the loss of 100% of earning capacity under the Employees' Compensation Ordinance. That means under such conditions, the person may be regarded as severely disabled because constant attendance from others on a daily basis is required. It should not be taken to mean that individual applicants will not be able to get the DA simply because of loss of earning capacity. There should be a reference point, but we'll also explain clearly to medical doctors for assessment that these two do not necessarily have correlations, and the focus should be on assessing one's functionality and see if the earning capacity has been lost to the extent of 100%. Now, you have set out all sorts of criteria like communication, abilities for emotional control, etc. Why is it that you still maintain this loss of 100% of earning capacity, which has been in place for 40 years? And secondly, for the disabled, they are really suffering, their families are also suffering. If they get the DA as soon as possible, then the burden of themselves and their families can be relieved. So can't you expedite your work a little bit faster? We can't wait for you to complete your work and then left everyone dying. We have like 40 minutes remaining, and it seems that members have been focusing on the definition and the timetable. So at the last meeting, during the public hearing, we talked about mental conditions and the loss of limbs, etc. If we also cover these points in our discussion, we'll be able to offer more comments for the administration to consider. If we continue to dwell into the previous points mentioned, it seems that they will not be able to answer us anyway. So I'm just providing a new direction for members. So we have two more members for the first round. Mr. Chen Yuen-han.
Thank you, Mr. Chair. I have a conflicting schedule, and therefore my difficulty in coming to the meeting early. My colleagues have told me just now about the procedures that went on before I came in. Now, Mr. Wong Kwok-che asked a question. The CE, C.Y. Leung, had made a promise, and then there was a working committee set up subsequent to that, but there's no timetable. And Mr. Wong Kwok-che and I had a discussion, and we find that this is unacceptable. Now, the 100% loss of earning capacity is one criterion, and we are clear as to certain criteria such as loss of limbs, etc. And it's very confusing, whereas you have a set of criteria, but you have to go back to the so-called 100% loss of earning capacity. You're going round and round concerning the definitions. I'm confused. Let me just ask Permanent Secretary directly, what difficulties are you facing? Is it because the SWD are asking you to add more criteria? Is it somebody else? What pressures are you under? Why are you inventing all these confusions? Ms. Chan, perhaps I should explain it this way in response to your question. The study or follow-up work of the SWD arose from the Ombudsman Review Report, its follow-up work. As for the interdepartmental working committee, it arose because of the CE's commitment made earlier concerning persons who have lost one limb and their eligibility to DA. Now, if we utilize the existing DA levels for single limb loss, perhaps it would be more straightforward. But we also notice that these persons who have lost one limb do not qualify for DA because DA eligibility requires severe disability. And therefore, our working group or working committee will have to consider other disabilities that do not qualify as severe disability right now, but which are more or less the same as loss of one limb in terms of severity of disability. And we have to look at these situations as well. And we have heard different groups and bodies, and there have been different opinions made. And we have found that there are different assessments and different standards of assessments for severe disability, such as ICF and others. And we also see that there are different assessments, different administration timing, etc., resulting in different findings. Well, Ms. P.S., I fully understand this. I would like to know, you're setting up all these hindrances. Why? Because of the ombudsman or because of what? I think you are dragging it on for the sake of dragging it on. I mean, who is setting up all these hurdles for you? I mean, it is completely superfluous what you said just now. If you say that disability allowance is to be granted to those who have lost one limb, well, so be it. It is straightforward. I cannot see why you have to go round and round in terms of definitions and other disability cases. Well, Mr. Chairman, we have heard so many different views from different bodies. We do not want to, in our working committee, grant the DA only to those who have lost one limb, but rather for similar cases to loss of one limb and who are now denied the DA, we should deal with these as well. Perhaps this is confused with the SWD's work. They are working on eligibility and appellant situations. Now, wouldn't this be overly bureaucratic? I think things are not as complicated as you think it is. In fact, we have dealt with similar situations before in various occasions, such as pay. And what is most controversial, as far as I remember, would be minimum wage applicability to the disabled. And there were measures which were able to be used as solutions. I mean, it's not all that difficult. It's not all that complicated. Why don't you just go ahead with it? There will not be a lot of objections, you see. My criticism is that, if you ask me, that the SWD is very problematic. They have set so many hindrances, and UAOs have been led around the garden path by them. Well, it's actually very straightforward. If you want to grant the DA, grant the DA. Yes, there may be other opinions, but we will face them together with you, such as the minimum wage setting. The disabled community had a lot of opinions about that. And I remember one time I almost cried. A parent came up to me about minimum wage applicability to the disabled, etc. But on the other hand, we cannot hinder the progress of the entire matter because of that. Well, actually, Mr. Wong had been very mild in his reaction. I mean, to my mind, it's a very cut and dry case. Mr. Chairman, my view is that let us not unnecessarily complicate what is very simple. Yes, we have heard a lot of that. No, but really, they're inventing complications here. Yes, we should approach it from that point of view. Mr. Long, Kwok-che, please. Yes, of course, I understand their logic. and that is if they adjust the bar, then for those cases which are denied, or similar cases which are denied DA, it may constitute discrimination. And this is exactly what discrimination concept is about, that it one affects all. But what you're saying is that, yes, there are criticisms in one sector, and what if we do not extend that benefit to others? Well, all you have to do is to come up with the sums. How much do you need? And go to the financial secretary for the funding. You can just say that the LegCo members, in order to live up to the civilized standards as it is now and to the yearnings of the constituencies, and therefore we have made this proposal. But of course the administration has its own procedures. If we raise a bar, there will be financial implications. If we have to grant DA to all, there will be more money spent. Well, we understand that. But that is the logic. But are you doing it or not? I mean, this is the CE's commitment, and the CE's commitment will be honored. Any objections will be sent to remote region of Shatao or even Guangzhou. The administration would not object in that case. I understand from a civil servant's point of view, you have to consider all these scenarios, but I can tell you, all those seated here at the LegCo today are telling you that we really should overcome this. And that is what we have now in Hong Kong, with all the wealth that we're sitting on. Should we not extend the DA and make it and grant it to an extended group? Now, the wealthy party is not here today because they feel that the moment you raise welfare, taxes will have to be raised, and less to them, you see. Now, if you say 9 months is not acceptable to you, then it's quite unreasonable. It's very simple. You have to have a target before you can have a target force. You have a target force, but if you have no target, it just doesn't work. And how do you set a target? You have to set a mission. And how do you set a mission? You have to set up a vision. And the CE's vision is that the society should become more harmonious. And for those who were denied their rightful aid, will be given the aid by raising that platform for all. So this is actually a political issue, and the political issue had been politically resolved. I understand you. We are talking about policy here. Let me put a very straightforward question to you. Will you or will you not make this possible as soon as possible, or put it into practice? Well, how many people would you benefit as you put this into practice? And come up with a sum and go to the FS for further funding for this extended group of people that you will benefit. You know, this is the political play. And you will have to consider that the Equal Opportunities Commission may criticize you. And some people may criticize that you're handing out money. Well, you are the PS. I understand this. Where is Mr. Chung, Matthew Chung? Where is he today? This is a policy matter. He should be here. Why don't you reflect this to Mr. Chung? Now, if you say that the CE is basically just mouthing it and he doesn't really mean it, if you tell me that, then I'll rest my case. Well, I think I know this most thoroughly. I truly understand the crux of the issue. We have a direct broadcast here today. Now, second round, Mr. Tan Ka-piu and then Wu Chi-wai. Thank you, Mr. Chairman. Concerning the motion, it being mild, I welcome amendments from colleagues, but as spoken just now, we can amend it as we want. But why half a year? Why not 6 months? Why not 6 months but rather 9 months? It's because of summer. 6 months would be summer, the break. So we are actually counting from December. We are allowing 1 year's time, and this is a very straightforward matter. Well, perhaps you can ask Professor Wong, who provided you with the survey report, whether he needed 1 year. Well, with your resources, with your manpower, why would you need 1 year? I mean, or 9 months. It would be very disappointing if you needed any more than that. Now, there are 2 papers here today. One is very lengthy, with a lot of responses. And I heard from the administration that they want to go with they want to put into practice the short-term measures first. But for those who have been denied DA, you're basically allowing them to go for appeal or judicial review. Now, I'm looking at CB bracket 2 LC paper. Points 6 and 7, page 3, that is, points 6 and 7 in that paper, even though you're keeping the qualifications constant, but in fact, you are already spelling out the qualifications or criteria. This is exactly what bemuddled the case for the medical doctors. Now, the wording is different from before, so what does it mean? I mean, and then there will be another report in 9 months' time. There will be new stipulations, and when that comes out, it will be more confusing. And Dr. Leung Ka-liu had said that he didn't know that there was this annex, and if you come up with something completely new again in 9 months' time, it would be quite unacceptable.
The more important point is that Mr. Wong mentioned just now, whether the Ombudsman, after its report in 2009, has accepted your adjustment or not. So I think, Chairman, we need to deal with CB bracket 2, this paper. We've spent 2 hours on the same issue. In the long run, I think that we can be mild. We can ask for 9 months and to try our best to shorten it to 6 months. But for this CB bracket 2, I'd like to seek members' views whether it should be tolerated or whether it should be scrapped. Mr. Tang, what would you like us to do? Chairman, I'd like to seek your opinion on how this CB bracket 2684 should be dealt with. I think we should express our views as that's the panel's view as a whole to the administration. Well, they have submitted this paper to us. It's tabled. You can decide whether to leave it on record or not, but whether or not you accept this paper, it's already been tabled. So does it mean that the administration will be going forward regardless of whether we accept this paper or not? PS or Deputy Director? As we said just now, this can be a short to medium term improvement measures. In terms of consistency, after implementing these measures, things will be improved. But we still need some time. We can implement these measures towards the end of this year, the soonest. In terms of the change in the definition, etc., these are longer-term measures, and we will cooperate with the relevant bureau. And if possible, we'd like to make this change in the short to medium term. But during the interim period, we'll also make other changes. We have drafted the the new guidelines, and there will be training for staff, and this will take some time. I personally do not agree that the administration should go ahead with this paper, because this will mess up the whole comprehensive review. Right before the second round is over, we have Mr. Leung Chi-chen from the first round, followed by Mr. Kwok-che. Mr. Leung, please. Well, I think on this subject of reviewing the disability allowance, it all boils down to resources. I personally think that have this view. I do not look at the technicality issues. Well, the chief executive has announced the proposal concerning people with loss of one limb, and this is something that the administration has to take forward. So the technocrats, such as your department, has to consider how it can be implemented. If you tell us your difficulties, then on the one hand, you're a government department in the executive of the government, and you should be carrying out the orders. But you tell us there are difficulties, and disabled people with other levels of disabilities would come out and object. And from this perspective, I can say that you still need to fulfill your mission. So I think that this is the spirit of Mr. Tan Kah-piu's motion. That is to say, you should regularly report back to us. And as to whether 9 months is the most appropriate time frame, I can't say so. I think it's good if you can come up with a time frame. You shouldn't instead come out later and tell us that the proposal cannot be taken forward because there is a lack of funding, etc. I think the Legislative Council should monitor your work. I definitely support it. As to whether it should be 9 months or not, I don't really agree that it should be 9 months because it's too long. So the administration and the PS in particular should consider the issue of resources when you conduct a review. On Wednesday, it's suggested that in the budget, $10 billion will be allocated to the Community Care Fund, and I think that we should resolve this issue by providing resources. There should be concrete proposals to help the needy. So I support Mr. Tan Kah-piu, but I wonder if 9 months is too long. Thank you, Mr. Leung Chi-chen. Next, Mr. Kwok-che. Chairman. Now, we're talking about disability allowance. Why are we complicating this simple matter? In the past, we had this Commission on Poverty. We had this panel, and we visited South Korea, and we understood that there were different levels of disability, and there were different forms of training, different opportunities in terms of training for the mildly, moderately, or severely disabled. Now, it's not such a complicated matter. It's all just about money. So how many levels can you have? I really don't understand it. I think one sensitive issue may be to do with Para 7. The Chairman, I need to declare that I'm a member of the Commission on Poverty, but I am not a member of the task force, including the one about the disabled. Well, there have been media reports already, and by the middle of this year, recommendations will be given to the administration. Well, is it the case that you're actually waiting for this commission, because it seems that they're playing a bigger role? About this paper from the Labour and Welfare Bureau, in Para 6, you talk about major work directions. I don't see anything about the collection of information data from other jurisdictions and etc. Well, I really don't see how this would take a long time. If you ask me to do it, I can do it in 2 months' time. P.S. Brief response. Chairman. As said in the paper, the DA is under the Social Security system. We believe that we should report to the Social Security and Retirement Protection Task Force. I have not proposed to report to the Special Needs Task Force, but if necessary, we can also discuss with the Social Security and Retirement Protection Task Force. In short, we are not waiting for or catering for the requests of the Special Needs Task Force. It's clearly set out in the paper that we will report to the Social Security and Retirement Protection Task Force, and if necessary, we would seek steer from the task force. If it's not necessary, we'll simply report to the task force instead of seeking steer from the task force. Now, about this task force set out in the paper, actually, I'm also a member. Now, the TV has made a report on the discussion of the other group, and that is to say whether the DA would be divided into 2 levels. The question is, I don't understand why it's taking so long. Well, maybe you should paraphrase your question, because she hasn't actually given us a timetable. So, Chairman, may I suggest 2 months? Mr. Tang is concerned about the summer holiday, so perhaps they can finish work before summer holiday. So how about May? Mr. Fong has suggested 2 months. Second round, Mr. Wu Chi-wai. Thank you, Chairman. In fact, my question during the first round was not detailed enough, but as I listened on, it seems that about the CE's statement in the manifesto that people with loss of one limb may be allowed to apply for DA. During the review, this might not be realized either. And it's very strange. This is a political decision. In the chief executive's manifesto, he has given this order that people with loss of one limb can be allowed to apply for DA, similar to the old age living allowance. So it all has to do with money. So if people with loss of one limb can be allowed to apply for DA as soon as possible, this will set down a yardstick. Whereas for allegations of other disabled people being discriminated against because of this new policy, well, this will be something for the Equal Opportunities Commission to deal with. If you draw this line as soon as possible, then medical doctors, when performing assessment, will be able to have an objective yardstick to rely on, rather than one simple rule of loss of 100% of earning capacity. So is it really a simple political matter or resources matter? Well, I'd like you to respond to this first question. Second part, I think that we have something similar going on for the $2 trip concession. It's now put under a known interdepartmental working group. So what will be the way forward for that scheme? For that scheme, it's even clearer. There are 150,000 eligible disabled people, and only those with a severe disability can enjoy the $2 fare. For people with other levels of disabilities, they may have other forms of subsidies provided by the government. For example, they may get a concessionary fare when they go to the swimming pool. It's clearly a problem, a question of resources. Why has it been turned into a question of policy? If it has to do with resources only, we can allocate extra funding for the public transport concession measure. As politically accountable officials, and we as gatekeepers, we should look at whether resources are sufficient. So, about the Chief Executive's suggestion or proposal in his manifesto concerning people with loss of one limb for DA, after the review, will it result in those people remaining ineligible for DA?
Mr. Chairman, we've looked at the terms of reference of the Working Committee. The first sentence was in the CE's manifesto. It's mentioned that there will be eligibility for the disabled with loss of one limb. And we go on to say that there will be recommendations from that working group, etc. But basically, I've pointed out at the outset that it is because of the CE's manifesto. So you're saying the baseline, Mr. Chairman, then she's saying that the baseline is loss of one limb. Yes, it seems so. If that is the case, then it's very straightforward. Loss of one limb, isn't it? That is the test. And then there are similar and relevant cases and scenarios, but probably through the medical doctor's assessment, they can say that this is similar to a case of loss of one limb. Then there can be further extension of that, wouldn't it? But it would give honor. It would honor the commitment at the same time. All right, that's your opinion, and will be noted. And the administration has duly noted that. Now, third round. Let us deal with the motion and the amended motion. 3 minutes, Dr. Chung. Yes, I have just handed in the amended motion. Basically, the time frame, 9 months, is just too long. But I would like to use the time to point out in the 2009 Ombudsman report, starting from 1973, when the disability scheme was promulgated, there were cases at the time of work-related injuries and disabilities. But given that we have to move with the times, this should be comprehensively reviewed. Since July of 2004, there had been various times of urging of the HA. The HA has repeatedly urged the SWD to review the eligibility criteria, and the MAF, as doctors, have difficulty assessing whether an applicant needs substantial help in working in the original occupation and performing any other kind of work for which he or she is suited. HA has also asked SWD to re-examine this misleading reference 100% loss of earning capacity, quote-unquote, in the eligibility criteria. HA's requests have not been taken on board. I do not know whether the administration finds it shameful or not. This is 2009 report from the Ombudsman, and the HA had several times urged you to review this. And the Ombudsman had come up with a very clear way forward, and you're still dragging your feet. And the so-called point-to-point response, it's been recommended that you delete this and you come back with 100% loss of working capacity. And it's been pointed that there are discrepancies with the SWD's criteria, and you say that there is effectiveness questions, and then you, for other recommendations, you say that it does not help with the assessment of inconsistency in disability. So you're rebutting each and every one of the points or recommendations, and you say that this is a point-to-point response. The bodies and the groups have made a very consensual recommendation. I do not know why you seem to be recalcitrant and still adamant in your ways. I would want to condemn this kind of behavior. 4 months I'm giving it, and then come back quarterly for report to the lecture. Yes, let me just make a brief conclusion here of the discussions. I believe the PS and the administration in the past 2 hours or just shy of the 2 hours have heard very clearly the lecture members. The baseline, of course, is loss of one limb. As to how you want to extend that definition is something that we can dwell on. However, in the very short term, that loss of one limb does not constitute severe disability is not acceptable. And also, the timetable, as I have mentioned just now, if you cannot come up with a timetable now, today, then at the latest in the March meeting or April meeting, you will have to. Now let us deal with the motion. First motion from Tang Ka-piu and another one from Dr. Chang. And here's a third one. Yes, in the motion, second last line. The new, it says the DA eligibility and the system for DA. Can we change it to the improvement of the new DA eligibility and the DA system? Yes? Well, I think the language is problematic with the amended version. Well, in the Chinese version, it is slightly problematic in terms of the language. This panel, shall we put in 3 more words in Chinese? Now, let me just read this out. If there are no other views, then this will be the motion. This panel concerning the interdepartmental working group set up by the LSB, and it's with its lack of a timetable, deplores that and finds it unacceptable. We recommend that within 4 months the interdepartmental committee completes its work and comes up with a recommendation, and by the end of the summer, come back to the LegCo for a report and comprehensively review the new DA eligibility and system. All those in favor, please. Yes. All those objecting to the motion? Yes, we reach a consensus in carrying the motion. Would the administration please note the opinions voiced in this meeting and in the next period of time come up with a response? Yes, we will end the meeting here. Thank you for coming to the meeting.